Nursing home care is expensive. Many people do not have long-term care insurance and cannot afford to pay private nursing home fees. The result is that government pays for a great deal of nursing home care through Medicare and Medicaid. Now, a real problem is that because these programs taken together do not pay well, they make it difficult for nursing homes to both make a profit and to provide quality care. Thus, many nursing homes choose to limit staffing in order to make a profit. Inadequate staffing, in turn, results in abuse and neglect of nursing home residents. Medicare, taken alone, reimburses nursing homes at a profitable rate. However, Medicaid can pay at a rate that causes a loss for the nursing home. So what happens is that nursing homes try to offset losses from Medicaid patients with profits from Medicare patients. So stick with me just a few more seconds. You'll see why this is so scary. Medicare pays for only a limited time and only for those people who meet specific guidelines. They don't pay for custodial care, which means you just need help with your activities of daily living, such as getting dressed, feeding yourself, and bathing. If you don't need skilled nursing care, Medicare doesn't pay. That means you need help with such things as getting intravenous injections and physical therapy, and you need the help of professionals. Well, Medicare pays the full cost for only 20 days. After that, the patient pays a large copayment up to 100 days. In fact, that large copayment changes every year. It's like $128 in 2008. And for 80 days, that's over $10,000. Once the 20 days is up, nursing homes know their profit margins will go down, and that's why things get scary. So tragically, we have seen many cases on nursing home neglect where the nursing home will discharge a patient home on the 20th day. That's not a coincidence. That's when the Medicare funding ends. They discharge the patient home even if the patient is terribly sick. And sometimes, because of that discharge, the patient doesn't get the right care, doesn't get critical care, and ends up dying. So what we think is very important is that you have this conversation with nursing home staff right at the beginning. You talk to the discharge planner, and we recommend that you make it clear to the planner that the choice of health care providers after the 20 days is up should be based on the patient's condition and not having anything to do with the fact that Medicare doesn't pay anymore.